Well, if we talk about the regulation of female monthly rhythm, it may be something that we joke about, but in reality, many women they suffer from the problems related to the interactions between their hormones and their brains. And when ignored, it can make women feel crazy or stupid. So, it is important for us to recognize the realities that women face and the struggles that arise from the dramatic changes in the hormone levels and the brain chemistry. So, all jokes aside, the mental state of women it has a domino effect that impacts not only the women but their families as well. So, let's look at the regulation of the female monthly rhythm, which basically is an interplay between the ovarian and the hypothalamic pituitary hormones. The hypothalamus it secretes GnRH, which causes the anterior pituitary gland to secrete the luteinizing hormone and the follicle stimulating hormone. Anterior pituitary hormones that is controlled by the releasing hormones formed in the hypothalamus and then transported to the anterior pituitary gland by way of the hypothalamic hypophyseal portal system. Now, GnRH is the hormone which has been purified and it has been found to be a decapeptide. Then keep in mind that the intermittent pulsatile secretion of the GnRH by the hypothalamus it stimulates the pulsatile release of luteinizing hormone from the anterior pituitary gland. And when I say intermittent, that then it means that it occurs every 1 to 2 hours and it lasts to 5 to 25 minutes because when infused continuously, the release of luteinizing hormone and follicle stimulating hormone by the anterior pituitary gland that is lost. So the pulsatile release of the GnRH that also causes the intermittent output of the luteinizing hormone secretion about every 90 minutes. The hypothalamic centers for the release of GnRH they include the arcuate nuclei of mediobasal hypothalamus and they control most of the female sexual activity. The neurons which are located in the preoptic area of the anterior hypothalamus they also secrete the GnRH in moderate amounts. So, multiple neuronal center in the higher brain's limbic system, a system which is said to be for the psychic control. So these centers in the limbic system they also transmit these signals into the arcuate nuclei to modify both the intensity of the GnRH release and the frequency of the pulses. The next thing which you should focus on is the negative feedback effects of estrogens and progesterones to decrease the luteinizing hormone and follicle stimulating hormone secretion. You must know that estrogen inhibit the production of both luteinizing hormone and follicle stimulating hormone, while progesterone, progesterone's inhibitory effect of estrogen that is multiplied. Now, the feedback effects they are mainly on the anterior pituitary gland directly and also on the hypothalamus, which result in decreased secretion of GnRH and they alter the frequency of the GnRH pulses. Now, also the inhibin from the corpus luteum that inhibits the follicle stimulating hormone and the luteinizing hormone secretion. Because the inhibin that is secreted along with the steroid sex hormones by the granulosa cells of the ovarian corpus luteum. And if we look at the effect in the female as in the male, inhibiting the secretion of that includes inhibition of the secretion of follicle stimulating hormone and the luteinizing hormone by the anterior pituitary gland. Well, another thing which you should not forget is the pre ovulatory luteinizing hormone surge, which is the positive feedback effect of estrogen before the ovulation, where the anterior pituitary gland excretes increased amount of luteinizing hormone 1 to 2 days, uh, beginning 24 to 48 hours before the ovulation. If we experimentally infuse the estrogen 2 to 3 days during the later part of the first half of the ovarian cycle, that will cause rapidly accelerating growth of the ovarian follicles and rapidly accelerating secretion of the ovarian estrogens. So anyway, this luteinizing hormone that causes ovulation, and the cause of this abrupt surge in the luteinizing hormone secretion that is not known. Although it has been suggested that the estrogens at this point in the cycle they has a peculiar positive feedback effect of stimulating the pituitary secretion of the luteinizing hormone, and to a lesser extent the secretion of follicle stimulating hormone. While this is in sharp contrast to its normal negative feedback effect that occurs during the remainder of the female monthly cycle. Without this normal pre-ovulatory surge of the luteinizing hormone, the ovulation it will not occur. So you should keep in mind that the uh, main thing is the feedback oscillation of the hypothalamic pituitary ovarian system. And the post ovulatory secretion of the ovarian hormones that also causes the depression of the pituitary gonadotrophins. You see, the corpus luteum it secretes progesterone, estrogen, and the inhibin, and it causes a negative feedback. As a result, the anterior pituitary gland and the hypothalamus they cause the suppression of both follicle stimulating hormone and luteinizing hormone secretion, and decrease them to their lowest levels about 3 to 4 days before the onset of menstruation. Let me now give you a brief account of general physical changes occurring in females at puberty. There is a axillary and pubic hair growth, and then there are changes in the body conformation, like widening of hips and the development of breasts. One prominent change is the onset of first menstrual period, which is called menarche. And of course, there are mental changes also at puberty. Female reproductive years, they are between about 13 and 46 years of age. During these years of adult life, 400 to 500 of the primordial follicles, they develop enough to expel their ova. Keep in mind that only one ovum is expelled each month. The remainder of the developing follicles, they become atretic by degeneration. Well, how would you define puberty? It is a period when the endocrine and the gametogenic functions of the gonads they have first developed to the point where reproduction is possible. What is adolescence? It is often also called puberty, and it is a period in which the gonads they are activated by gonadotropins by the pituitary to bring about final maturation. Pre-adolescence is the stage 1 of puberty in both the sexes. Let's see now the sequence of events in puberty. In girls, the sequence is thelarchy, which is the development of breast. Next is pubarchy, means the development of axillary and pubic hair. Then comes menarche, which is first menstrual period. Another event that occurs in humans at the time of puberty is adrenarche, which is the onset of an increase in the secretion of adrenal androgens. The age at the time of puberty that is variable. Puberty generally occurs between the ages of 8 and 13 years in girls and 9 and 14 years in boys. Although it has been declining at a rate of 1 to 3 months per decade for more than 175 years. For adrenarche, it occurs at the age of 8 to 10 years in girls and at an age of 10 to 12 years in boys. Well, now the next question is that how the onset of puberty is controlled. The gonads of children can be stimulated by gonadotropins. Now, their pituitaries contain gonadotropins and their hypothalami they contain GnRH. However, their gonadotropins they are not excreted. Only the pulsatile secretion of GnRH brings on the puberty. Don't forget that during the period from birth to puberty, a neural mechanism of unknown nature that is operating to prevent the normal pulsatile release of GnRH. Gonadotropin excretion that is not being held in check by the gonadal hormones. In children between the ages of 7 and 10, a slow increase in estrogen and androgen excretion that precedes the more rapid rise in the early teens. Well, now let's get back to this figure, which shows the hormonal changes that occur at puberty in females. In stage one, the FSH levels they start rising, LH rises slightly, and it's a stage of pre-adolescence. In stage two, LH remains stable, and the stage itself is characterized by the breast buds. In stage 3, there is a steady rise in LH which takes place, and there is elevation and enlargement of breasts. In stage 4, FSH level becomes stable with the projection of areolas, while in stage 5, the estrogen level is peaked, resulting in adult breasts. Now, this condition is pathologically delayed puberty. It is when menarche has failed to occur by the age of 17 or the testicular development by the age of 20 years. Failure of maturation is often associated with the dwarfing and other endocrine abnormalities. The normal variation in age at which the adolescent changes they occur that is very wide. And in the case of primary amenorrhea, in some individuals, the puberty is delayed even though the gonads they are present and other endocrine functions they are normal. Menopause is the end of female reproductive capability, at which only a few primordial follicles they remain in the ovaries, and even these follicles they degenerate soon thereafter.